Diabetes mellitus is a group of metabolic diseases that are characterized by hyperglycemia, resulted from defects in insulin secretion, insulin action, or both. HbA1c test measures the average amount of glucose attached to hemoglobin over the past 3 months. HbA1c test can assist in determining whether someone is at risk in developing diabetes, diagnosing diabetes and prediabetes, monitoring long-term diabetic control, and determining treatment options. Every test will have its own advantages and limitations. Same goes to the HbA1c test. The advantages of HbA1c test include the specimen is easy to collect from the patient without complex requirements. This test also serves as an overall marker of average levels over a period of 2 to 3 months that give better reflection of how levels of sugar in the blood are being controlled over time, and this may improve the efficiency of the health system. Next, HbA1c test also has its limitations, which are this test cannot be used in patients with abnormal red cells, and the level A1c also will appear increased with age. This test also will not be influenced by daily fluctuations in blood glucose concentration, which is unsuitable to be used for adjusting the insulin doses. A blood sample may be taken in two ways, either by pricking a finger with short pointed lancet or by inserting a needle into a vein. Sample collected must be approximately 3 ml whole blood in lavender top EDTA tube. Do not aliquot specimen as it must be sent in the original tube. The specimen stability may last up to 3 days in room temperature, but if it is refrigerated, which is preferable, it could last up to 7 days. HbA1c can be analyzed by using high-performance liquid chromatography (HPLC). HPLC is an analytical chemistry technique for separating, identifying, and quantifying each component of hemoglobin molecules. Separation is based on charge in the ion exchange HPLC, whereas separation is based on structure in affinity chromatography. A pressurized liquid solvent containing hemoglobin molecules passes through a column filled with a solid absorbent material. Each component in the sample interacts differently with absorbent material, resulting in variable flow rates and separation of glycated and non-glycated hemoglobin products. The expected result for the HbA1c are given in percentages, which are for the normal results, HbA1c will be below 6%, for prediabetes between 6% to 6.4%, and for diabetes will be 6.5% or higher. Normally, the HbA1c level is lower than 6%. If between 6% and 6.4% mean the patient has a higher risk to develop diabetes and cardiovascular disease. Diabetes patients may have 6.5% or greater, basically less than 7%. If untreated, the patients may have a level of more than 8%. The higher the hemoglobin A1c, the weaker the blood sugar control and the greater the risk of diabetes complications. An increase of 1% HbA1c concentration causes an increase in all-cause mortality and cardiovascular or ischemic heart disease mortality among individuals with diabetes. Elevated HbA1c related with independent risk factors for CHD and stroke in patients, and increased risk of recurrence of atrial tachyarrhythmia, which cause the heart rate exceed the normal resting rate. Reducing 1% of HbA1c in diabetic patients cause less likely to suffer cataracts, heart failure, amputation, and microvascular complications. HbA1c can be useful in identifying various clinical significance related to diabetes mellitus. Thus, it is preferable test to be used either for diagnosing or monitoring diabetes.